My name is John Camp, and I'm the Vice President and Chief Operating Officer of the American College of Healthcare Trustees, and I'd like to welcome you this morning. I get the honor and privilege to introduce to you our President and Chief Operating Officer of the American College of Healthcare Trustees, Dr. David Levien. Dr. Levien received his BA from Johns Hopkins University and his MD cum laude from Georgetown University of Medicine. He was chief resident at the University of Massachusetts Hospital and served his colorectal surgery fellowship at the Ferguson Clinic. He is boarded in general surgery and colon and rectal surgery and has a certificate of added qualifications in surgical critical care. He received his MBA from the University of Massachusetts, Eisenberg School of Management. Dave achieved the faculty rank of professor of clinical surgery at Jefferson Medical College and New York Medical College. So I'd like to introduce and give a warm welcome to Dr. David Levien.
Thanks. I want to thank John very much and thank him for taking the position of Vice President, Chief Operating Officer. He's really helped us go to the next level. He's really fits in perfectly with our organization, being a black belt in Six Sigma and Lean, which is one of the important things that we do in hospitals. He's also a consummate business coach and planner and organizer, and really been fabulous. So thank you very much. Really appreciate it, John. Our corporate sponsors have been invaluable, and we really couldn't do this without our corporate partners. So I'd like to thank Mary Beth Kimball, and we're going to talk about all of our corporate partners later as we move along, and each one in its turn. We're going to go into a little bit in a little bit more depth, but the Eisenberg School of Management and Mary Beth have been great corporate partners, and Raj Gupta will be speaking later, is an expert on corporate finance, and he'll be talking to us on how hospitals can have a margin. Then case management covenants, Dr. Ola Kunye-Ilanen has been a great friend, and he helps hospitals get adequately paid. And the revenue cycle is very important. We know about the no mission, no margin. Then ARC Document Solutions has been another great corporate partner for which we're very thankful, and they have made this possible. We have Kumar Varatanga, who's the Director of Technology, and he's been wonderful, and he's brought a whole team with him, and we'll go into what they do for healthcare a little bit later in the presentation. So in any event, just to give a brief overview of the American College of Healthcare Trustees, essentially what we do is support good governance. And we want to give members and stakeholders a rallying cry, and we think the mantra of supporting good governance is even more important than our mission and vision statement. So governance is something for which I have an academic interest, but there's also a very practical interest, and that's why we have the American College of Healthcare Trustees. Governance has played a role from medieval times with town councils, College of Cardinals, and nowadays major corporations. And many of the disasters we've had have been when the boards of directors have been asleep at the wheel. So by supporting good governance, we feel like we're supporting quality health care in the United States. And as a surgeon for many years, I felt that my sacred obligation was to the patient, and that still remains true. But we also have a wider obligation to the community and physicians are recognizing this, board members are recognizing this. So we not only, if the input is the patient and the community, and the healthcare organizations really have to create the processes to provide health care that's efficient, compassionate, timely, et cetera. And then the output, of course, we hope will be a happy, healthy community and patient. So I want to thank you very much. And now I'd like to introduce Mary Beth Kimball, who's going to talk a little bit about the University of Massachusetts MBA program